We discuss contractor management. The contractor management is the managing of outsourced work performed for an individual company, employer, or organization. Contractor management implements a system that manages contractor health and safety information, information, training program, and specific document that pertain to the contractor and the client. We can see as per the HASWA Act 1974, the Act applies to all work activities. It requires employers to ensure, so far as is reasonable practicable, the health and safety of their employee, other people at the work on their site, including the contractor, member of the public who may be affected by their work. So it is a legal requirement also to ensure the safety of the contractor who are coming to work at the employer premises or the client premises. The references from the managing contractor HSG 159, Construction Design and Management Regulation 2015, guidance related to contractor management. Who is the client or customer? A person or an organization that authorize or engage to any another vendor or any service provider or any supplier or outsource any work or any civil work, job, service, supply requirement known as the client. Sometimes the client may be known as the customer or maybe the in the form of consumer, buyer or purchaser also. Now we see who is the contractor, a person or an organization as a vendor, service provider, supplier, outsource, perform a certain work. Any type of work like it may be a job, service or supply requirement time to time for the another employer or organization or any client, that person is known as the contractor. Or that organization is known as the contractor. Related to construction sector, we see various type of a principal contractor, subcontractor, construction contractor, specialist contractor, works contractor, etc. Now we can understand more about the management of contractor and the client. It can be broken down into 5 key areas. The references is there, HSG 159 from the www.hsc.gov.uk. The step 1 is the planning the work. Step 2, selecting the contractor or choosing a contractor. Step 3, coordinating the work or contractor working on site. Step 4, monitoring and managing the work, keeping a check. Step 5, reviewing the work. So these are the 5 steps to be used while we are managing the any type of contractor. We can see the step 1 planning, define the job, identify the hazard, assess and control the risk, specify health and safety condition. Step 2, what health and safety competency is needed, go through information about the job and site, ask for a safety method statement from the any contractor before selecting. There are the other factors also that we will go and study. The step 3, once the selection criteria of the contractor is over, then the contractor is coming on the site and contractor sign in and sign out provisions, name a site contact details, reinforce any health and safety information and site rules, check the job and allow work to begin. Then start the step 4, keeping a check. While the work has been all basic information given to the contractor in step number 3, then we are coming to the keeping a check. The employer will or the client will monitor or maybe controlling the contractor, assess the degree of contact needed and how is the job going, whether it is going with safety, following the safety protocol, rules, regulation and procedure. Then the step 5, reviewing the work. Review the job and contractor and record the any lessons learning. Now we can go step 1 in detail, planning the work or planning first part when client pre-planning to involve the contractors. The step 1 planning the work or when client pre-planning to involve the contractor. The following points should be considered when pre-planning to involve the contractor. So many organizations cannot do all the work by themselves, so they need to hire the various contractor. Health and safety must be included in the contract, tender, scope of the work, specification. It may be in the form of request for proposal, expression of interest, request for quotation, tender notice, etc. All significant hazard must be included in the contract specification. The contract documented should be prepared with safety in mind. The contractor must be given basic site and health and safety information of the workplace by the client, such as welfare, fire safety, emergency procedure, significant hazardous material storage, chemical storage, PP requirement, etc. in the scope of the work. Now we see the step 2, the selection criteria of contractor or choosing a contractor. We can see the various factor of selecting the contractor. So once we are going to selecting the contractor related to health and safety parameters or factors, we should check it. Like we need to check whether the contractor is having the health and safety policy, whether the contractor is having the employees liability insurance certificate of his workers, and he has provided contractor has provided insurance cover to all its employee. That need to be checked. The risk assessment need to be checked. The example of contractor quality risk assessment need to be checked. The safe system of work or similar safe system of work like PTW, SOP, JSA, JHA need to be checked. Contractor has safety method statement that also need to be checked. We can see the qualification records like competency level of the contractor need to be checked. The qualification and experience record of the contractor's staff or worker need to be checked. Experience of similar type of work need to be checked whether in the past contractor completed the similar activities or not. That need to be checked. Skills, contractor has the skill to perform that activity or not. That need to be checked. Training records, a record of each contractor, employee induction training, job specific training, ongoing training, and health surveillance record to be checked. These types of training the contractor has provided to his workers or not, that record we need to check it. We can see the any accreditation held by the contractor of any professional body or any legal authority by their country or by local authority, whether the contractor having the membership of trade bodies or membership of a professional organization or certified body, for example, license to carry out that type of work, whether he is authorized from IOSH, Institutional of Occupational Safety and Health, he is having some membership or the registration under that particular country legal system or not, that need to be checked. We need to check whether the contractor has the membership of contractor health and safety assessment scheme or not. We need to check contractor meeting the legal compliances or not. We need to ensure or check name of the previous client of the contractor. That to be considered to assess the past performance of the contractor. We can check the current client or customer to use as a reference whether the contractor existing health and safety performance is satisfactory or not. We can find out the accident rate check from the contractors, accident statistics, accident and incident history records like near miss records, LTI lost time injury record, first aid cases to be checked. The enforcement action record will be checked. Record of any enforcement action taken against by the against the contractor by the enforcement authority need to be checked. Prosecution action, any prosecution action taken against the contractor or not, any health and safety formal order issues against the contractor or not to be checked, like any HSC or legal notices, any type of improvement notice or provision notice issued against the contractor or not to be considered. Available resources like proof of advocate resources, availability of all necessary PPEs, safety equipment to be checked of the contractor. The competency of health and safety assistance, whether the contractor has access to specialist safety advice or not, need to be checked. Selection procedure for subcontractors to be checked. Subcontractor management system to be checked. HSC plan to carry out the work safely to be checked. Emergency procedure implementation or not to be checked. Health and safety management system whether contractor is having that occupational health and safety management system or not need to be checked. We can check the equipment maintenance record of the maintenance and test for plant and equipment like any lifting equipment, crane, hoist need to be checked. Whether they are having maintained for a regular maintenance done for and upkeeping their equipment or not. Equipment inspection record whether contractor having safe machine and equipment, otherwise defective machineries will lead to the accident. Arrangement for managing work on site is done by the contractor or not need to be checked. Arrangement for consulting its worker is done by the contractor or not at the site need to be checked. Arrangement of safety monitoring need to be checked by the client. By these following these many factors, we can give the answer of these questions, list the criteria that might be used to assess the suitability of a contractor to undertake work on behalf of a client. Or we can see what are the factors that should be considered when assessing the health and safety competency of a contractor. One question was being asked in the previous OBE when selecting the external contractor, what would you consider when assessing their competency? So we can write the answer like health and safety policy need to be checked, membership professional body license need to be checked, previous performance need to be checked, accident incident statistics need to be checked, training records need to be checked. So we can make a list and we can write in our answer. Now we move to the step number 3. After the selection of contractor, the contractor has come to our site, working at site, and we have to coordinate as a client. We need to coordinate the work with the contractor. We see what are the points can be covered during working at site. The following information to be shared between the client and contractor. Prior to start of work, health and safety policy should be exchanged. Exchange information with them about the job and go through any safe working method before work begins, like scope of the work to be discussed, risk assessment methodology to be discussed, method statement to be discussed, any other provision which required by the client and the contractor, that information need to be exchanged. The contractor must be given basic site and health and safety information of the workplace by the client, such as welfare facilities, fire safety, the alarm, first aid facilities, emergency procedure, significant hazardous material storage, chemical storage, etc., to be provided to the contractor. The contractor must be given basic site and health and safety information of the workplace by the client, such as welfare, fire safety, the alarm, first aid facilities, emergency procedure, significant hazardous material storage, chemical storage. Hazard posed by the site and the work carried out. Hazard posed by the contractor activities need to be considered. The coordination should include to avoid any conflict between the client and the contractor during stages of the work. Coordination is mandatory and should be mutually resolved without affecting work and others. Communication and cooperation are needed on both sides, something that requires the active management for smooth coordination of the work and activities. Any information and instruction relevant for a new contractor to carry out their work safely is provided to them. Regular planning meeting between the clients and contractor is required. Ensuring activities do not conflict, the priority can be defined. Permit to work system to control the high risk activity to be included. We can see name a site contact, someone to get in touch with on a routine basis or if the job changes and there is uncertainty about what to do. So key contact from both sides like work foreman identify to ensure the continuity like contractor representative and owner representative need to be considered. Establish a timetable, time schedule for formal and regular review of the contractor safety management system through inspection, audit, and safety meeting need to be considered. Now we come to the step number 4, keeping a check or monitor and control between the client and contractor. After the step number 3, keeping a check, now we have given the full authority to the contractor to execute the work with the safety. So it is mandatory the client should check time to time to the contractor. So client must monitor the work to ensure the safety. The client can stop the work if contractor involves unsafe practices, unsafe act, violation, mistake, rule breaking, etc. Following arrangement should be made between the client and the contractor for ensuring safe managing of the work. Is the work being done as agreed in scope of work? Is it going to be as planned or not? Ensure site induction are provided. Reasonable steps are taken to prevent unauthorized access. Follow up as per risk assessment shared between the both. Follow up as per safe system of work, permit to work system, method statement, share and agreed between the both at step number 3, where client and contractor both have exchanged the information and derived a solution to ensuring the safety while work is progressing. Client can go for safety inspection and safety audit against agreed method statement to monitor the health and safety performance of contractor. Such inspection and safety audit should be undertaken regularly on the company's own health and safety system. So we can have a better control of the contractor. The client should enforce use of PPEs and safety equipment being used at the workplace, reinforce health and safety information, enforce the site rule, follow instruction of the client. Signing in and out is important for all contractor whenever they come and go. Are the contractor health and safety system actually in place and are they being followed? Are they working safely? Liaising with the contractors. Have there been any incident? Are any other special arrangement necessary to ensuring the safety at the work need to be monitored. Such inspection and audit should also be undertaken regularly on the company's own health and safety system. And the client can enforce use of PPEs and safety equipment being used at the workplace, reinforce health and safety information, enforce site rules, follow instruction of the client. The signing in and signing out is important for all contractor whenever they come and go. Are the contractors health and safety system actually in place and are they being followed? Are they working safely? Are they liaising with the contractors with proper outcome of the problems? Have there been any incident, any near miss, minor injury, or any other special arrangement necessary to ensure the safety? Contractors workers to be consulted and engaged in securing the health and safety while they are working on the client premises. If any problem arise, taking the prompt action where necessary. If any deviation identify, work should be stopped for review till mutually agreed again by both. Effective supervision required of the contractor. Adequate welfare facilities ensured by contractor to its worker. Adequate resource availability like man, machine, material should be there to ensure the safety of everyone. Ensure those engaged to carry out the work are capable, competent of doing so. Ensure effective, preventative, and protective measures are put in place to control the risk by the contractor. Ensure the right plant, right equipment, and the right tools are provided to carry out the work involved. The time management, sufficient time to be provided, and the deadline should not be passed. Priority to be given to health and safety while the contractor is working. All the legal compliances to be complied by the contractor. All emergency readiness and preparedness ensured by the contractor. Once the work is completed, now the last step comes the reviewing the work of the contractor, which include the contractor performance and evaluation. So once the job has been completed, it is necessary to review the job. A review should be used to improve on future contracts and should include a review of the outcome and achievement of the contractor. The verification of the advocacy of procedure in place need to be considered. Any amendment or addition to the procedure, if necessary, to be done. Recording and rating the overall performance of the contractor against the established criteria to be done, and provision for feedback to the contractor also to be done. By seeing these 5 steps of the managing the contractors, we can try these questions like question number 1, how the organization could reduce the risk to contractors before the project start and during the project. So before the project start, then we can write the step number 3, like coordinating the work between the contractor and the client. And step number 4 and 5 can be written like managing and monitoring the work between the client and contractor and reviewing the work. We can see the question number 2, an organization has all of its maintenance work carried out by contractor. How the organization can help to ensure that this work is carried out safely. So if all the maintenance work is done by the contractors, then they need to follow the all 5 steps. The planning, when they are planning to hire the contractor, they should include the maintenance work, scope of the work, and in their tender document, and then select the appropriate contractors. Then after selecting the contractor, coordinating the work with the contractor, and checking the contractor, and step 5, reviewing the contract. We can see some sample questions. Contractor question number 3. Contractors are carrying out a major building project for an organization. How this organization could reduce the risk to contractor carrying out the project. So here also we can already the contractors are carrying out the project. It means then they already decided to hire the contractors. we can assume that step number 1 and 2 might has been completed by the organization. Then we can see step number 3 and 4 and 5 are most relevant than step number 3, like working on site, step number 4, monitoring the contractor, and step number 5, reviewing the work with the contractor. Now we see the question number 4. Based on the scenario only, discuss how effectively the contractors will be managed by the organization during the modification. So here in this particular question, maybe the contractor already hired, then we can see the step number 3, 4 and 5 can be written for a appropriate answer. Thanks.